The broadcast is now starting. All attendees are in
Hi,
listen-only
and
mode.
welcome to today's presentation. I want to start by first thanking all of our healthcare providers and their staff who are doing an outstanding job during this healthcare crisis. I'm especially pleased to have received hundreds of emails and phone calls from all types of healthcare providers who have reached out to see how they can take care of their patients during these challenging times. Just as the rules and regs on how the crisis is being managed is changing on a daily basis, so are the rules and regs as they relate to telehealth and remote services. I don't normally speak on a disclaimer slide, but this slide is true now more than ever. The information in this presentation is updated as of 3/17/2020. I urge all of you to stay updated by using the links in this presentation and by signing up for the updates. I'll point out those links as we go through the presentation. So we do have a busy agenda. We're going to talk about what options you have. There are so many more options than just telehealth. CPT over the years has created many remote types of services, ways that you can take care of your patients, particularly during this type of a situation. We're going to talk about some terms and definitions. It's important for us to understand the language as it relates to telehealth. What is the difference between telehealth rules and regs for Medicare, Medicare Advantage plans, Medicaid, and Medicaid HMOs or MCOs? We'll talk a little bit about telephone services. Those are equally as important. And some online digital E&M services, remote physiological monitoring treatment management services, and throughout the presentation, there'll be resources where you can stay updated. So the following really should be considered. What are your patient's needs? What's the best type of remote option for the patient? And that might be simply based upon age or based upon the type of electronic equipment that they have. The best options for your practice. It's going to change. You don't have patients walking through your door anymore. So what's your schedule going to look like? The patient's insurance. The rules and regs are going to differ based upon the type of insurance that the patient has. So these are all things that really should be considered when you're talking about these remote services. So the first thing we're going to do is start by looking at the rules and regs for New York State Medicaid. And I want to stress this is New York State Medicaid. It's also important to note that the Medicaid HMOs follow the Medicare rules and regs. And Medicaid eMedNY website is a great place for you to go to get all of these updates. So I do have these links listed on this particular slide. I strongly recommend you bookmarking some of these, calling them favorites, and going to them every single day. This information is changing on a day-to-day basis. And again, I'm going to point out those links that you can go to sign up, where this information will be sent to you automatically. So this slide includes the link for Medicaid's policy on telehealth, which we're going to review shortly on the upcoming slides. And again, I would tag some of these links that are on here as well. And these are some more additional links. Just want to get them out of the way. We have some phone numbers here that you can call with questions. And again, throughout the presentation, we'll be providing you with some helpful phone numbers that you can utilize as well. So a few days ago, New York State Medicaid issued this special edition. This went into effect on March 13th, and it covers the changes it has made to telehealth services during this healthcare crisis. As you can see, many of the restrictions surrounding these types of services have been lifted, and this is to allow more patients to have access to healthcare professionals without the risk of coming into contact with large groups of people or even having to leave their homes. The good news is that CPT has been keeping up with many of the remote service codes, which makes it possible for physicians and qualified healthcare professionals, or QHPs, to continue to provide healthcare to their patients without in-person office visits. it's really great to see that both Medicaid and Medicare are easing these restrictions on the services to make use of these codes possible, particularly during this time of need. So some of the restrictions will still apply. And remember, again, we're talking just about New York State Medicaid. The rules and regs have some difference for Medicare, which we're going to go over later in the presentation. So you can see that telehealth is going to be covered for all appropriate services for all patients that are appropriate to treat through this modality. Okay. Let's take a look at the rules and regs for telephone services first. We look at the CPT codes as well. First off, we see what types of professionals can provide the telephone encounters, and we note that they may have to be actively enrolled in Medicaid fee-for-service or Medicaid managed care plan. On the second bullet, we see that if the call is related to an office visit, which was performed and reported within the past 7 days for the same diagnosis, you would not report the telephone call. And remember, this is because all E&Ms or office visits include a post-service work that's related to that visit that took place. Again, I want to stress this is applicable if the call is for the same diagnosis. It could be a different diagnosis, in which case the call can be allowed. The other thing I want to mention is that a lot of the codes that we're putting up here are found either in your CPT manual or in your HCPCS, that's the Healthcare Common Procedural Coding Manual. And they have extensive parentheticals, they have extensive guidelines. We'll go over as many as we can during the presentation. But if you don't have those manuals, I would urge you to get them. This would be a good time to stay updated. If, however, the patient would require a face-to-face visit, which is not possible due to the current state of emergency, and if the provider feels that the telephone visit is appropriate and medically necessary, it will be a reimbursable service. As always, the patient's record must be appropriately documented, and I would go so far as to say that, especially since both Medicaid and Medicare are bending the rules, you want to make sure that you're actually documenting the notes appropriately. So here we see what the CPT codes look like. Again, these are Medicaid rates, but the CPT code is applicable to all different payers. The 99441, this is a telephone service, and I want you to take note that there is a time element attached to this. This particular code is 5 to 10 minutes of medical discussion. So that means that any time-based code, you have to have the time documented in the medical record, and the reimbursement is listed here. Again, this is Medicaid fee-for-service. Here are the additional codes. Again, we're going to note that time is a required documentation element. CPT has a more robust definition. However, we're currently focusing on Medicaid and Medicaid HMO requirements. But again, as stated before, you want to make sure that the time is documented along with the reason for the call, as well as your assessment and plan or summary of what this call was based upon, and particularly the reason for the call. On this slide, we can see the changes that are applicable to telehealth services. And basically, all telehealth encounters are exempt from co-payments, which is really a good thing, something that we've never seen before. So now we're going to take a look at the rules and regs from Medicaid and New York State Medicaid telehealth services. And on this particular slide, we get our definition of what telehealth is and what is considered to be inclusive in a telehealth service. Notice it includes your assessment, your diagnosis, your consultation, treatment, education, self-management for the patient. So much like a SOAP note would be how you would document these services. One of the key terms that we have to become familiar with telehealth services is the originating site. So we first have to identify the originating site, and this is defined as where that member is located at the time of service, and it has to be within the United States or United States territories. This slide includes a list of approved originating sites. I highlighted some of the more common areas, and during this time, it's especially important to note that the member's place of residence is included as an originating site. The distant site is where the telehealth provider is located at the time of service. And on this slide, we also see that the telehealth communication must be HIPAA compliant and meet all of the other relevant laws and regulations that relates to the patient's privacy, confidentiality, and we must have the patient's consent. And here I want to note that HIPAA may be relaxing some of their rules and regs, and I would check this out with your healthcare attorney or check on some of the healthcare attorney websites. They would be able to offer you some more information, particularly where you can go to stay updated with any of those changes. Another word that we see that's used a lot in telemedicine is synchronous. So it has to be a synchronous telemedicine service, okay? And it has to, again, meet those key components or requirements of the same service when it would be rendered face-to-face. And synchronous simply means it's existing or occurring at the same time. So this is where you're using that two-way electronic audio-visual communication, where I can see the patient can see me, and we can communicate with each other. There's also store and forward technology. Now, this is a little bit different. This is asynchronous. That means it's not happening at the same time. And this refers to the transmission of patient healthcare data in the form of maybe pre-recorded videos or digital images. And this is from one provider at an originating site to another provider at a distant site. So it's not doctor to patient or physician to patient. This is provider to provider, and it's really talking about a type of technology that's either pre-recorded video or some sort of digital image. This type of service reimburses at 75% of the Medicaid fee-for-service, and you would append a GQ modifier to the CPT code for that professional service. As we go towards the end of the Medicaid portion of this presentation, we're going to talk a little bit more about the various modifiers and how they're used for the various types of remote services. Another type of remote service is remote patient monitoring. This is growing more and more every year. You can see it from CPT. So the other option, as opposed to telephone calls or telehealth, is remote monitoring. And this service is applicable to patients who have devices that record data that needs to be analyzed and monitored by their healthcare professional. So you see there are a number of options and various services that can be provided remotely, which would allow the physicians and healthcare professionals to still take care of their patients. This slide lists the rules and regs for remote patient monitoring. And again, at this point, I'd urge everyone to check out that E&M section of your CPT manual. That's the first section of your CPT book. This is where you're going to find many of these additional remote services. So now would be a good time to get acquainted with them. This slide lists many providers who can provide telehealth services as long as their specialty and provider type supports the CPT code that's reported. So, for example, not all providers can bill for evaluation and management services or E&M codes or office visit codes. At the end of the presentation, we're going to discuss some of those remote services that can be reported by other non-physician specialties. So just because you see on some of these slides a speech language pathologist and physical therapist and occupational therapist, this does not mean that they can report those E&M codes. They can do some remote services, but their code selection is going to be different than those E&M codes that we're used to seeing for our visits, those 212s, 99213, 45, that type of thing. And the list does go on. Over here, we can see some other types of providers as well. And all of this information actually comes right from that Medicaid update. And here's the rest of the providers on that list. This slide lists the New York State Medicaid requirements. One of the key requirements is that the providers must be acting within the scope of their practice. Again, that refers to who can bill these E&M codes, right? And whether or not they're face-to-face or online, it doesn't make a difference. Even though it's not a face-to-face, the requirement for that E&M still is applicable. The note has to be documented accordingly as well. Patient confidentiality remains. As mentioned earlier, you can reach out to your healthcare attorney for further guidance on HIPAA regulations, but privacy must be maintained during all patient-practitioner interactions. You also have to have documentation that the patient was informed that they'll be receiving telehealth services and the use of the technology that was utilized. Translation services must be available to those in need of that service, and the patient has to be informed at that initial encounter that these will be telehealth services, how that's going to happen, what type of equipment you're going to use. And I would document all of this in that patient's medical record. And this slide lists all of the rights and consents that are required. So remember on that previous slide, we said that you have to have the patient's consent. You want to make sure that whatever consent you're getting from this patient includes all of this information. They're informed, they're made aware of the location, where you are at the time this is happening, the type of technology, etc. Failure of transmission, you have to have documented policies and procedures. What are you going to do in this type of a circumstance? Okay. Anybody who has a written Medicaid compliance program should have this listed in the program already. If you do not, now would be a good time to update your compliance program. So again, as I mentioned, these things change. So if you have a compliance program and it's just been sitting on your shelf collecting dust, now might be a good time to dust it off, look it over, and make sure that you get that updated. And here we have our modifier slide. Okay, so this is where we can see the required modifiers that are utilized for telehealth services. Notice modifier 95. In red, it references that it's going to refer you to the CPT Appendix A for a list of those covered CPT codes. And modifier 95 is for that synchronous telemedicine service. That's that real-time interactive audio visual type of communication. Appendix A lives in the back of your CPT manual. And this is again where your CPT comes in handy. And for those of you who don't read the entire manual, the appendices are where some of that best information is located. You can look at your GT modifier. This is for use with those services provided via synchronous telemedicine for which modifier 95 cannot be used. And here's that GQ modifier that we saw earlier on. That's for that store and forward type of technology. Modifier 25, you might say, well, where does this come into play? Well, supposing the member has a psychiatric consultation via telemedicine on the same day that primary care might have seen the patient, right? So here you're going to use a modifier 25. And that's when that E&M service and that psychiatric service were at that same originating site. I would be very cautious with the use of this and how many telehealth services are being provided to that same member on the same day from that same originating site. And this is Appendix P of the CPT manual. This will list all of those synchronous telemedicine services that are approved by Medicaid for use of Modifier 95. And of course, we have our place of service code. And here we're told to utilize place of service 02. And this is basically saying that this is a telehealth service. And note that we do get the prompt that we have to append one of these modifiers when we're using place of service 02. The list of place of services, again, can be found in your CPT manual. That's on the front pages. This is a handy slide. This has phone numbers that you can call if you have questions that relate to Medicaid telehealth requirements. And these are some more. There's a lot of guidance. There's a lot of information that's out there. When you go to these sites, again, bookmark them. And this is the best way to stay updated because truly these rules and regs are changing as the sun comes up. I started this PowerPoint on Monday, and it had changed 3 times by the time I'm presenting it to you now. Now we're going to switch gears from New York State Medicaid to Medicare. And this new guidance was just issued today, March 17th of 2020. The effective date of this notification goes back to March 6th of 2020. And these changes are made possible by the Coronavirus Preparedness and Response Supplemental Appropriations Act. This slide really summarizes quite nicely the changes that are going to go into effect for Medicare. So anyone who was trying to report telehealth services to Medicare patients prior to this act being passed, you'll know that these are really big changes. First, that rural area restriction has been listed. That was a biggie, a big hurdle to overcome. Now patients can be seen via telehealth at any location, including their homes, which is fantastic. Certain smartphones will be allowed to be utilized to provide telehealth services as long as the key word here is both the patient and the provider's phones have that audio video capabilities enabling a real two-way encounter. So the emphasis is on both. HHS will not conduct audits regarding to the patient's status. So to the extent that that waiver that comes out with that act requires the patient have a prior established relationship with a particular practitioner, HHS will not conduct audits to ensure that such a prior relationship existed for claims submitted during this public health emergency. Practices have the option to waive or reduce patient copays. So these are really big steps for Medicare. And you need to check the list of Medicare approved providers for telehealth, which I will give you on one of the later slides. Okay, so these are some really helpful links for Medicare. We have a fact sheet. We have some FAQs, which there's really some good ones that are in there. The best one is the last link. That's where you can sign up for CMS updates, and you will be getting these, trust me, sometimes 2 and 3 times throughout the day, but it does help to keep you updated, so I would definitely click on that link and sign yourself up for it. A couple of more links to stay updated with the press releases that are coming out, coverage and payment that's related to the COVID-19. So you do get some fact sheets as it relates to the codes for the laboratory testing, the diagnosis codes, some really good information. These are well worth looking into. This slide, the first link is going to take you to that list of Medicare approved telehealth and remote services, including the CPT and the HCPCS codes. These are all listed in an Excel format. Really great. It gives you the code and it gives you the code description as well. The second link takes you to a MedLearn document, and those of you who have attended any of my webinars know that I am a fan of MedLearn because it takes these complex rules and regs and puts it into very simple English. The only caveat that I have here is that this document was written prior to the lifting of restrictions to the rules, but it does have some good health information in there. So it does give you the types of providers who can provide telehealth services. That didn't change. The types of CPT and HCPCS codes are in there as well. Those are in like a PDF format instead of Excel. And it does give you some modifiers, I believe, as well. Just remember that the rules and regs have been reduced, and this MedLearn document is just going to give you some background information in a little bit easier digestible format. It talks about the originating sites and the distant sites and all the terminology that we were speaking about. So the Medicare Advantage plans. Notice at the beginning of this year, Medicare Advantage plans had the liberty to relax some of these rules and regs, which Medicare is just doing now. So I would say anybody who participates with Medicare Advantage plans, typically they do follow the Medicare rules when Medicare makes these sweeping changes. But if you go to look at some of their policies, you're going to find that they actually had done a lot of this work prior to Medicare implementing this. We have virtual check-ins. This is, notice it's a G code, okay? G2012. This is a brief communication technology-based service. This is what they call those virtual check-ins. These are things that are done. Again, you have to look at who can report it. You have to be able to report a E&M service to report this type of a virtual check-in. This is for an established patient. And again, it doesn't originate from an E&M service that was provided within the previous 7 days, nor would it link to an E&M service that's going to happen within the next 24 hours or at your soonest available appointment. This is also a 5 to 10 minute discussion, so time would need to be documented. These online digital services in all types of locations include the patient's home and in all areas, not just rural. These are for established Medicare patients, and they may have non-face-to-face patient-initiated communications with their doctors without going to the doctor's office. And this is by using your online patient portal. Okay, so when the creation of the portal first came out, I know everybody was complaining about it. When are we going to use it? Oh, we're just using it for laboratory tests. Maybe I update it, maybe I don't. Here's an excellent use of your patient portal. You paid for it. You might as well put it to good use. You have the list of CPT codes that are on here. Notice that this is cumulative time during a 7-day period. These are time-based codes. So again, you want to be able to make sure that the documentation includes the time. The patient must verbally consent to receive virtual check-in services, and the Medicare coinsurance and deductible does apply to these services. Medicare Part B also pays for e-visits or patient-initiated online evaluation and management that's conducted through the via patient portal. And again, these are for practitioners who can bill for those E&M services, such as physicians, nurse practitioners, physician assistants, those types of providers. And these are the requirements that are there. All of these requirements are actually listed in your CPT manual. These are in the guidelines, and the guidelines are always listed prior to those CPT codes being listed and the descriptors. Notice since they're time-based, this slide will tell you what that time includes. Maybe you're reviewing that initial inquiry. Maybe the patient is just sending you something through the portal and now you have to pull some records. You want to research the patient's problem, and then you want to be able to get some management plan, generate a prescription, right? Ordering of tests or other communications with the patient. This can be done online, telephone, email, digital, various types of ways. Okay. And again, it has some restrictions as to when you could report it. And again, that's because those E&M services have that post-service work and some pre-service work that's attached to any type of visit that the patient has. Now, what happens if you're a speech-language pathologist, an occupational therapist, or a physical therapist, or some other type of non-physician professional? I've received many, many questions on this during the past few days. There are codes. These are HCPCS codes. They come from the Healthcare Common Procedural Coding System Manual. These are time-based codes. These are just like the codes we just reviewed that were for physicians and qualified healthcare professionals, such as a nurse practitioner or a physician assistant. These types of codes are for your non-physician healthcare professionals. These are online assessments and management. And we did speak a little bit before about the remote physiological management codes. This slide highlights monitoring of patient self-measured blood pressure. So again, I really urge you to look at that E&M section of your CPT manual. There's so many different codes in there. We just touched upon some of the more basic ones. So in summary, this presentation, I hope, provided you with some insight into the various remote services that you can provide to your patients to keep them healthy and safe during these challenging times. And I want to thank you for attending. I hope you found the information helpful to you, and please stay healthy and be safe.